Hi, I'm Dr. Kelly Miller in my office this afternoon in Temple Terrace, and I wanted to share with you a little bit about an exciting new FDA-cleared device. It's called the Thyroflex. The Thyroflex actually measures the bioactive form of thyroid hormone called T3 that's inside the cells. What we found, which I talked about in my thyroid chapter on 13 Secrets to Optimal Aging, is that the reference ranges for thyroid are almost worthless. It's very difficult to diagnose a patient using TSH, free T3, T4 for a hypothyroid condition, and it's almost impossible to manage them using these values. So the Thyroflex much better matches the patient's symptomatology than the blood work, and it's 98.5% accurate. It's much more accurate than the blood work. So this is what we use in our office to determine the level of hypothyroidism, and this is what we use to help titrate the patient with appropriate supplementation to get the thyroid functioning better. So we're going to do a test on one of our fellow doctors here in the clinic, Dr. Jamie Brim, in a few minutes, and we'll see how that works. Okay, today we're going to talk a little bit about a new FDA-cleared device called the Thyroflex. The Thyroflex actually measures intracellular T3 levels. So this is telling us how much of the bioactive form of the hormone, which is T3, is getting inside the cell. So today we have Dr. Jamie Brim here as our guinea pig, and she's filled out a Thyroflex questionnaire, which has symptoms for symptoms of thyroid, symptoms for thyroid, adrenal, sleeping patterns. So all this gives us information about the patient. We plug it in to the computer software, and now we're going to conduct a test. Okay, so to determine the proper reflex point, we first just put 2 fingers down off the elbow, we draw across, and then we have the individual extend their middle finger back and forth, and right there X marks the spot. That's where that muscle that controls the tendon that makes that finger go. So we see a little jump on the middle finger. That's what we're trying to isolate. So now that we've got the proper location, we're going to slide on the electronic monitor over the middle knuckle. And then we're going to use a percussion hammer to stimulate the reflex. So we got both feet on the ground. Okay. And producing a graph. So usually after you've done this once, you have to kind of distract the patient. So we have to ask them to subtract 6 from 100. So 100 minus 6 is
94.
94 minus 6 is
88.
88. Okay, great. 88 minus 6 is
82.
Okay. And hang on one second, because we're just going to okay. So 82 minus 6 is
76.
okay. All right. Get one more graph. Minus 6 is
70.
okay. Okay, so we have a reflex point right here. So this is the bell graph. And then we're averaging these readings. Okay, so this is the reflex interval score from the Thyroflex, 201 milliseconds. So an ideal score is 50 to 100 milliseconds, and satisfactory marginal is this first yellow band, 100 to 120 milliseconds. This pre-fire scores or neurotransmitter speed. That's the speed with which how fast her brain reacted to being stimulated from the tendon. This is the resting metabolic rate, 1,743 calories. So because she's hypothyroid, her resting metabolic rate has decreased. So normally this would be around 2,200, 2,250 calories. So it's about 500 calories less than ideal. So when we have the thyroid function is in this range, the resting metabolic rate will be much higher because the furnace, her metabolism is burning, and the furnace is burning faster, and she's burning more calories. So this is one of the reasons why the hypothyroid person has trouble losing weight, because they're of a diminished resting metabolic rate. So the protocol is to put on a specific protocol of supplements to support the thyroid, and then after 30 days retest. As you can see, the test is very quickly done, 3 to 5 minutes. It's a non-invasive test. It's less expensive than blood work. You get the feedback immediately. You can immediately know the degree of dysfunction in the thyroid. You can immediately make a change in the dosage. We evaluate the patient every 30 days. Our experience has been that it usually takes about 3 or 4 months to get the optimum titration of the T3 into the cells. So we're going to be doing more videos on this. For more information, just go to healthrestoration.solutions, and we'll be talking to you soon.